We start tonight with a live look over Michigan State University's campus, where professors and researchers are sharing their concerns today on World AIDS Day. It recognizes the progress of global HIV prevention efforts and those who have died from the disease. Good evening. I'm Seth Wells, filling in for Ann Emmerich.
And I'm David Andrews. One MSU professor is looking into a new policy in Washington that restricts funding for certain activities that are designed to stop the spread of HIV worldwide. News 10's Jaden Hawkins here in studio now with more on how this could affect millions of people around the world. Jaden?
Hi, David and Seth. The Trump administration announced earlier this year it would freeze millions of dollars for the U.S. president's emergency plan for AIDS relief, a program which has saved more than 26 million lives globally. I spoke with local experts on how this will affect the global fight against HIV.
Very earliest days, there were no medications, and people were being diagnosed and then they were passing away. And with today's technology and medication, a lot of people will never progress to AIDS.
Christina Schmidgall from the Lansing Area AIDS Network says a lot of progress has been made against HIV, but now those advancements are at risk.
If federal funding disappears, HIV doesn't disappear. It will continue, and it will continue to impact the community.
The new American First Global Health Strategy focuses on distributing a new HIV preventative drug for pregnant and breastfeeding women. The State Department says just 40% of U.S. funding against HIV overseas goes to frontline efforts. The goal is to make foreign HIV programs more efficient and less dependent on U.S. aid. But according to MSU researcher Dr. Robin Lynn Miller, the new plan leaves out support for the most vulnerable groups: gay and bisexual men, transgender women, and sex workers.
Leaving those populations out will not get us to end the epidemic.
Miller says according to her projections, these cuts will lead to 4.1 million additional deaths by 2030.
We say treatment is prevention. If somebody has access to HIV treatment and they take their medications regularly, as they should, they're not capable of transmitting the virus.
Miller says diseases don't stay within national borders, and cuts overseas could have a negative impact on Americans. She encourages people to educate themselves on the issue and says there are volunteer opportunities in Lansing for those who want to help.
All right, Jaden, thank you. On Thursday, the Lansing Area AIDS Network will host a candlelight vigil at the Unity Spiritual Center to acknowledge World AIDS Day.
Shifting